Refractive procedures are done to remove glasses. Refractive procedures are cornea based, anterior or posterior chamber based and lens based. The cornea based procedures are laser correction or LASIK. The anterior and posterior chamber are phakic IOLs. And if we change the natural lens with an artificial lens, we call it refractive lens exchange. All these procedures correct refractive error or remove glasses. Now, there are limitations of LASIK. We cannot make cornea very thin, so the high power cannot be corrected by LASIK. Once the high power is not corrected by LASIK, the next thing is phakic IOL. So, those cases in which we cannot do LASIK, we can still go ahead and do phakic IOLs. For phakic IOLs, we have a parameter that the distance between the cornea and the lens should be 2.8 millimeter and angle should be wide open. So, if these two criteria are there, we can do ICL or phakic lens in that. Phakic lens are polymer material, they are biocompatible and they do not cause reaction with the normal tissue. So, they remain inside without causing any disturbance to the adjacent structures, and they give good quality vision in comparison to LASIK, because LASIK is causing some change in corneal surface. So, the quality of vision sometimes comes down, while the ICL they do not cause any change to the ocular structures. So, the quality of vision is better, and the ICL is reversible procedure. You can remove it if the patient gets old, and then we can do a cataract surgery in that. So, ICL has a definitely advantage over the LASIK procedure, but because the LASIK is extraocular procedures, we prefer LASIK over ICL for normal cases. If the corneal thickness is less, still we can go ahead with ICL in these cases. ICL is very simple to implant. We make a small opening 2.8 millimeter and the injector systems is there. We can inject the lens in the anterior chamber and then we place the lens between the iris and the original lens. The patient recovers within a day. It is just a 10 minutes procedure, no pain, no injection is required for this. Very next day, patient is happy with this. This is done one by one, we do not do both the eyes simultaneously. So, usually we take a day gap for doing the other eye. ICL has been improving in its quality. The initially if you see it was coming a plain lens, nowadays it is coming with a hole in the center. The hole is provided for the aqueous circulation for better nutrition to the ocular surface. So, for all those cases in which LASIK is not possible, we can do ICL, and even in those cases which LASIK is possible, borderline, ICL can help in those patients. So, ICL has a wide range of refractive corrections. It can correct hypermetropia to the high, very high myop up to 23 diopters. So, if you compare LASIK and ICL, definitely ICL has some added advantage over that. So, ICL is going to be in the market, and with recent technologies advantage coming to that, it is going to be much better in future.